back onto how it worked, I guess I should have used this metaphor. I love it. It's kind of like when you go out into the sun with a dark shirt on and you feel the sun heating you up, versus I go outside in this white coat and the sun, the energy reflects off. So that's how laser hair removal, it clings to that darkness, that melanin that's in the hair, and kills it.
Welcome to the Beauty Talk podcast, where we feature how the best medical practitioners help their patients to look better, younger, and healthier. Now, enjoy the show, and here's your host.
Daniel Gao here. I'm the host of Beauty Talk, where we feature the top medical practitioners in health and beauty, both inside and out. I have Jamison Stewart, who received his Bachelor's of Science in Nursing from Union University in Jackson, Tennessee in 2010. After his undergrad, Jameson was a traveling nurse, practicing in 10 different hospitals located in 6 separate states. During this time, Jameson's nursing career primarily centered around cardiology. However, he also worked in the surgical, orthopedic, and aesthetic specialties. Jameson attended Purdue University Global, receiving his Master's of Science in Nursing with a concentration in primary care in 2020. He is board certified as a family nurse practitioner from the American Academy of Nurse Practitioners. He opened Nouveau Derm Aesthetic Center in Myrtle Beach, South Carolina in 2021. His favorite part of aesthetic medicine is when clients experience the wow moment after they see the results they desired. So Jameson, welcome and glad to have you here.
Great to be here, Daniel.
Yeah, so let's start with this. How did you first get interested in medicine?
Well, both my parents were doctors. My father was a vascular trauma and general surgeon. And as a kid, I could always remember he was in his white coat and fixing people. I used to say, "Oh, Dad's going to cut guts." And I just thought it was the coolest thing in the world. I would go and watch him operate, even as a kid, standing outside, in the gallery, watching him operate. And I just was like, wow, he's in there like removing a gallbladder. And I just thought it was cool. And my mother was an ER physician. And so I would go watch her do her stuff too. And that's, where I first saw the EKGs and thought, wow, that's the heart beating. And I just wanted to know what it was all about. And so I just had a passion for it early. And that's how kind of I got into it. From a young age, I just couldn't think of doing anything else. I just wanted to help people.
Okay. So then what prompted you to end up in the aesthetic side of medicine?
Well, I'd done 10 years as a travel nurse and usually travel to contracts doing, at different heart centers doing cardiology work and on cardiac floors, step down and telemetry and the like. And I just decided after 10 years, I wanted to try something different. And so I decided to go back for my nurse practitioner and went and did it. And believe it or not, my girlfriend was shaving her legs in the shower. We were about to go on a date and it was taking forever. And I was like, there's got to be a way out of all of this medical stuff that I can make this process go faster. So that's kind of what spurred me into it. I wanted to how can I use my brain to make this easier? And then I realized that there was a big market for people that wanted to look their best and wanted to look, younger. And so I got into aesthetics, kind of like, well, this could be fun. And it turns out that it was. So yeah,
Okay.
I launched it.
And so then what caused you to decide to open up your own practice versus just working for another aesthetic practice?
I just figured when I got out of school, I would never have as much guts as I did then. I really feared going and working for somebody else and becoming comfortable and not ever having the opportunity again, or because you get a paycheck and then you're like, oh, okay, well, I don't want to go risk losing this job and starting my own thing. So I wanted to just grab life by the horns, and so I did. And it's like, if it works, it works. If it doesn't, it doesn't. I can always go work for somebody else, but I want to try it now. If I was going to do it, I'm going to do it right out of school.
Okay.
So,
Well, sounds like it's been working well so far.
oh yes, it has. It's been very good.
Okay. Now I know that your practice does a lot of different things, but I really want to dive down deeper into the laser hair removal part of what
Absolutely.
you do. So, from my understanding, there's 2 different types of, I guess, lasers that comes to. So, could you talk a little bit about that?
Well, there's many different types of lasers, but
Hmm.
there are two that I use in my practice here, specifically for laser hair removal, as well as some other things, but mainly laser hair removal. So there's the Alexandrite laser, which is 755 nanometers in wavelength. So think about a laser like a big, flat, fancy flashlight,
Hmm.
and so it emits light, you know, on a spectrum, on a wavelength, and these wavelengths can be attuned for different skin types. So to understand then which skin types, but we'll go into that later. But basically, Alexandrite laser and ND-YAG laser, which stands for neodymium doped yttrium aluminum garnet laser, and that is at 1064 nanometers of wavelength. So those are the two types of lasers I use: Alexandrite and YAG.
Okay. And then when it comes to this to the skin types, let's go into that one next since you mentioned that.
Great.
How does it depend on what type of skin you have as far as I guess the lasers used or the treatment used? Because I mean, if it's laser hair removal, I'm just thinking, oh, it's just the hair.
Right.
It's nothing to do
One
with the skin
laser.
type.
Right.
So you can talk a little
So,
about that.
so we all fall on a spectrum of it's called a Fitzpatrick scale, and so there's a Fitzpatrick scale 1 through 6, and one would be like a Fitzpatrick 1 patient would be a like a redheaded individual with really pale skin, or someone with very pale skin that sunburns very easily. And 6, a Fitz 6 would be like Steve Harvey, very dark skin. And so these patients, and we all fall in between that range, 1, 2, 3, 4, 5, and 6. And these patients require different treatment options, different lasers, and different settings, depending upon what their Fitzpatrick scale is, what they are.
Mm,
So,
okay.
yeah. Mhm.
And so, how does the skin type uh, differ with the type of lasers you would use then? I guess is there just like from the Fitzpatrick scale 1 to 3, use this laser, and then
Yes,
4 to 6,
that's
use another?
exactly right.
Oh, okay, got it.
That's exactly right. Yeah. So
Okay.
an Alexandrite laser works really well for those with pale skin. So fits 1 to 3, you primarily want to be looking at an Alexandrite laser,
Mm-hmm.
whereas fits 3 through 6, you're going to be looking at an ND YAG laser. And the difference is that wavelength. So Alexandrite is, as I just said, was 755 nanometers of wavelength, whereas the YAG is 1064.
Mm-hmm.
And so if you actually look at light on a spectrum, the YAG laser you can't even see because it's infrared, almost not infrared. It's you just can't see it. It's not a visible light,
Okay.
and so it passes through melanin, so it passes through that dark skin, and hits the follicle
Mm-hmm.
beneath the skin. So whereas if you'd use an Alexandrite laser on a patient with very dark skin, you would just burn them because it would attach to the melanin not only in the hair follicle but also the skin, causing a burn. So you wouldn't want to do that.
Okay. So then
Yep.
I guess let's take a step back then, because I think let's
Yep.
start with how does laser hair removal work? Because I mean,
Okay.
when I thought about laser hair removal, I'm like, okay, like you put a laser, and I guess for some reason I thought like, okay, you're like removing like the hair from your
Right.
body,
Almost like waxing.
yeah, but I guess it's like you I guess you use the laser to I guess kill like the root, and then that's what leads to the hair falling out.
Yes. So
Okay.
let's pretend you shaved your face. You
Mhm.
shaved your face 24 hours ago. If you touch your face, you're going to feel stubble, little bits of hair that has started to grow back out. So laser works by adhering to the melanin in the follicle. So what gives your hair color is something called melanin produced by melanocytes, or melanin producing cells. And so the laser hits the hair and travels down into the bulb and harms or damages the matrix cells, the stem cells, as well as the blood supply that feeds that follicle. So,
Mhm.
what we're trying to do is damage that hair's ability to grow back. But
Okay.
then again, you have to think about, when you're doing laser hair removal, the different phases of hair growth. There's 4 different phases. There's anagen, catagen, telogen, and exogen. I'll make it real simple, like Act E.
Mhm.
So anagen is that growth phase when the hair follicle is engorged with blood, and it's really growing, and so the hair on your head stays in the anagen phase very long, longer than the hair on your arm, right? Because the hair on your head gets longer than the hair on your arm.
Mhm.
The um, the catagen is kind of a transitory phase. The telogen is a dormancy phase when that blood supply is shut off, and the exogen is when your body's actively trying to shed the hair.
Mhm.
So that's why you lose your hair and then you grow it back.
Mhm.
We all shed hair and then grow it back. And
Mhm.
so laser hair removal is spaced out because each one of your follicles, all the tens of thousands of follicles all over your body, hair, they're all free agents. So they can be in different phases you know, it's not like every single one of your hairs on your head is in the anagen phase in the beginning,
Mm.
at the same time. So
Mhm.
this is why laser hair removal is also spaced out, different weeks, like you'll come back and get another treatment. So
Okay.
that.
Okay, got it. That makes a lot more sense then.
Mhm.
Now, now you mentioned as far as the coming back for multiple treatments and time in between. So on
Right.
average, I know it's probably depend on the individual and then what areas they want to have the
Mhm.
hair removed from, but on average, how many sessions do people go through and how much time do they need in between sessions?
Different areas of the body require different time spans. So the legs, the bikini versus the underarms versus the face.
Mm.
Um, Usually the number of sessions though would be between, I'd say, at least 6 sessions.
Mm.
So what the industry standard considered to be a successful laser therapy treatment for laser hair removal would be a 70% follicular reduction, meaning I want to see 70% less follicles than I did when we started. Um, Typically in our office, we're getting between 80 and 90% follicular reduction. But
Mm.
just know with laser therapy, though, you'll never get hair as gone as the palm of your hand.
Mm. Okay.
But to answer that question is how many weeks? It really depends. It depends on what I'm seeing also with the patient, but it can vary weeks. But so between, I'd say, 4 and 8 weeks in between
Okay.
those, just depending upon what area of the body it is, that we'll schedule a follow up. Hey, do we need to treat again? Do we need to wait a little bit longer?
Mm.
It's really patient dependent though.
Okay. So the entire time frame you're looking at somewhere between 6 to 12 months or so for the entire thing?
Yes, yes,
Okay.
yes, right about there. Mhm.
Okay, got it. So now, when it comes to getting the treatment done, when the treatment is completely done, is that permanent? Like, hair's never going to grow back again, or is it kind of
That
like
is a good
they'll
question.
come back after 2 years, 5 years, however long that is?
That is a great. I get that question a lot. So that
Uh,
the hair follicles that we killed are absolutely dead. They are not going to come back.
mhm,
However, since you're, and I always say this, since you're a mammal and since you're alive,
mhm,
you are always going to want to grow hair.
mm,
So um, typically patients come back maybe once a year for a touch up. Some of my patients, depending upon, usually younger patients usually grow more hair.
mhm,
Older patients, especially women that are postmenopausal, typically don't grow as much hair. So I might do a laser treatment on their legs. The leg hair just disappears at a 98% follicular reduction. And then they don't come back for 2 years. They might come back 2 years later and say, "Oh, hey, I've got a couple here, like below my knee or something," and I'll just shoot those off. Whereas a younger patient, I guess say the fertile range, um, uh, will can seems in my practice to grow hair back a little bit quicker. But the
mhm.
follicles that we killed are dead. But you're
Okay,
always going to want to grow hair because you're
okay,
alive and you're a
yeah,
mammal.
okay. And I'm sure you get this question a lot. Also, is it painful?
Actually, no. I've never had a patient stop laser hair removal and
Okay.
say, you know what, Jameson, I've already had one of these, or I'm halfway through this session and I can't do this anymore. It's just too much.
Mm,
So it feels like a hot rubber band pop. Um, it's not too bad. I wouldn't say. I've done it to myself. Just I always tested on a because I'm a Fitz 2
yeah.
based on the Fitzpatrick scale.
Mhm,
Like I want to know what this feels like. I want to know what the patient's going through.
mhm,
I've done it to my girlfriend. I've done it to my medical assistant. I've
mhm.
done it to hundreds of patients. But so I've never had anyone say, this is unbearable. I can't do this anymore. I can't stop. Like we
Okay.
need to stop this.
Okay, good to know.
Yep.
And I'm just curious, like when you're actually doing the treatment, are you kind of doing it like hair by hair, or is it kind of like more like broad strokes across
That
all
is a good
hairs?
question too. So when I'm setting up my laser, there's a couple of settings I'm looking at. So I'm looking at spot size, so how much area is being shot.
Mm-hmm.
I'm looking at pulse duration, so how many milliseconds of energy, how much time span needs to happen, that how much energy I'm pushing into that area. I'm looking at joules per centimeter squared. So that's a setting I look at, how much energy. So you're looking at the amount of energy versus the time spent versus the spot size. So all of these determine the depth of a bigger spot size is going to not go as deep, whereas a tinier spot size is going to penetrate a little deeper. So it just depends on all of those things are variable depending upon the patient's presentation, the area I'm treating, their skin type, what time of the year it is, all of those things. I know yeah. So no, I'm not treating individual follicles. It
Okay.
is more of a carpet area. So you shoot, shoot, shoot. I typically go for a 30% overlap in my shots when I'm doing laser hair removal.
Hmm.
Um, any more than that, and you could risk, burning. It's not to say that it's never done,
Hmm.
but you typically want to remain about a 30% overlap with your shots.
Okay, got it. And also, does time of year make a difference, like when you get this done?
Yes, sir. Absolutely. So with my laser hair removal patients, I almost always shut down laser hair removal for a month or two during the summer because with laser hair removal, I don't want my patients for a couple of weeks before, as well as a couple of weeks even after the laser therapy, to go into the sun
Mhm.
because it can make you photosensitive. You're more susceptible to burning, sunburning, because the when you just it just makes you more susceptible because I've
Mhm.
shot you with high energy,
Okay.
and you may burn.
Mhm.
And also depends on medications. So there are certain medications that people take, such as doxycycline, which is a commonly prescribed antibiotic that can make you more photosensitive. So not only time of year, but I'm also looking at so that's why I've talked to my patients. I want to say, like, hey, do you go to the beach? Hey, do you go to the pool? Do you lay out in the sun for the purposes of gathering sun? I'm not so much worried about patients, walking to their car, but
Mhm.
laying out in the sun for the purposes of gathering sun, I would not want to do their legs, obviously, because during the summer and spring.
Mhm.
So, but if a patient comes to me and says, "Hey, Jameson, I'm inside all the time. I work from home. I'm not going to the beach." Yeah, we could do it, but it's very variable, meaning dependent on the patient's
Got it.
presentation. Mhm.
Okay. Now, I also want to understand a little bit more about skin conditions. Are there certain situations where if someone has a certain
Oh,
skin
yes.
condition, they shouldn't do it, or it's okay, or like what are some of those things that people need to be aware of?
Um, Let me think. Um, there are some good conditions that laser hair removal helps treat, good skin conditions, such as pseudofolliculitis barbae, which is very common in it's common with everybody, but more common so with African American population. You'll see razor bumps where people shave and then they
Mhm.
get bumps
Mhm.
on their skin, and these bumps can appear dark. It's where when you shave a hair and the hair almost forms like a needle because you've shaven it off, and it kind of forms like a little
Mm.
like a little bevel on it.
Mhm.
And so when that hair starts to grow back, it starts growing into the skin, causing a bump, a razor bump.
Mhm.
Um, Women that shave their bikini area are very familiar with this phenomenon, and that happens to every Fitzpatrick type, not just the darker ones. But so laser hair removal can be a great option to kill that follicle, so it doesn't have to be shaved. So it's
Mhm.
heading it off at the pass.
Mhm.
Another thing that it can be used for, which I'm really, really loving, that we've kind of discovered this in the most recent years, has been a couple of studies since 2022 to 2024 showing laser hair removal's use with a condition called hidradenitis suppurativa,
Mhm.
which can appear where skin touches, like underneath the arms or in the groin or even underneath the breast, but typically you'll see it in the groin and the arms, and it will appear as little boils or bumps
Mhm.
that caused from the hair follicle actually becoming clogged. And we don't know why this exactly happens, but the hair follicle gets clogged with dirt or debris or bacteria or biofilm. And then it becomes an abscess, almost like a boil. And then that can tunnel down in the skin. And it can be very debilitating to patients. But if we can identify that early, the hidradenitis suppurativa patients, because most cases um, of hidradenitis suppurativa patients live with it their whole life and they don't know what it is.
Mhm.
And they just have these sores, and then these sores leave scars, and it can be very, very debilitating. So, laser hair removal can be an excellent option. A matter of fact, I just read a systematic review in that was published in 24 of this year, and it demonstrated that laser hair removal significantly improved hidradenitis suppurativa uh, cases in regardless of the laser used. Just get laser hair removal. So I thought that was very interesting.
Okay. So even certain conditions, laser hair removal can treat these conditions then.
Yes,
It's
absolutely. It is.
incredible.
It's amazing. I know, and it's a big fancy flashlight. So
Yeah.
back onto how it worked, I guess I should have used this metaphor. I love it. It's kind of like when you go out into the sun with a dark shirt on and you feel the sun heating you up, versus I go outside in this white coat and the sun, the energy reflects off. So that's how laser hair removal, it clings to that darkness, that melanin that's in the hair, and and kills it. So
Okay,
yeah.
that's a great example then.
Yes, sir.
Okay, now I'm curious because I'm sure I've asked a lot of questions about this, but I'm sure there's even more questions that people ask, maybe misconceptions or myths when it
Okay.
comes to laser hair removal. What would you say some of the most common myths or misconceptions you hear from your
Myths and
patients on this?
misconceptions. I guess the biggest one, laser hair removal is meaning if I get laser hair removal once, or I do a full treatment of laser hair removal, I will never, ever, ever have to get. I will never grow any hair again. That's the most common one. Like I said in the beginning, no amount of laser hair removal will ever make a part of your body like the palm of your hand. You will always have hair to some capacity. Now, what we're trying to do is set expectations with patients to make sure that we have a certain percentage of follicular reduction. Like I want to be able to visibly see that there is less hair there at a certain percentage. So that would be a popular misconception. Other than that, I really don't. It's pretty straightforward. I mean, we do the
Mhm.
laser, the hair goes
Yeah.
away.
Oh, there you go. That makes it real simple.
Yes, sir.
Okay,
I guess
perfect.
I guess a popular misconception is I'm serious though when I ask patients, please, please, please don't go to the beach the day after.
Mhm.
Um, uh, you get laser therapy, whether from me or anybody else, please listen to that. The instruction, don't go to the
Mhm.
beach because you will burn those areas that were fine.
Mhm.
After your treatment, you'll go to the beach and get a little bit of a tan, and you'll notice when you come back that those areas are now painful
Mhm.
because um, so just be careful with the sun, listen to your providers, listen to the post-treatment instructions. It's not completely innocuous, even though it's a big fancy flashlight and it seems like it's nothing because it's just light. It's serious stuff. So
Yeah.
yeah,
Okay, that's great advice then. Now, when it comes to another piece of advice you can give, Jameson,
yes
if
sir.
someone is looking to get this treatment done, but they don't know which provider to go to, what are some things that you would recommend for them to keep an eye out for, or just be aware of when they're looking for that good provider?
Huh. Well, if a provider cannot sit down and have a basic conversation with you, like on this podcast, like what are the stages of hair growth? Which laser do you use? Why did you select that laser? If they can't answer basic questions, interview your provider as much as they're interviewing you. Ask them all the questions. See how their bedside manner is. See if they look you in the eye. Do they take time with you? I think one of the best things is your provider should be talking to you and spend time with you, and that's what I always like to do. I would look at Google reviews, look at what other patients have said that have had those treatments done. Do they like them? And the pros and the cons, that kind of thing. That's what I would do.
Mm,
But I would also ask the person that's actually doing. Sometimes it's not the provider. I know in this state, in my practice, I do the laser treatments, but ask the person that's doing the treatment, how many of these have you done? Um, really feel them out and interview them as much as they're interviewing you.
okay, great advice. Now, Jameson, I'm curious, what role do you believe creativity plays in how you approach your patient care?
Creativity.
Yeah.
Um, Well, I don't think there's any one size fits all approach to medicine. Medicine is just as much art as it is science. So I do think there is definitely creativity. I hope this answers your question. What I'm
Yeah.
getting.
Mhm.
Um, I every patient has no two people are alike.
Mhm.
For instance, Daniel, you might be eating different foods. You might have a different lifestyle than I do. You might have different issues than I do. Genetically, you might be predisposed to different things. All of these things go into assessing a patient and treating a patient, and every single one of them has to be considered.
Mhm.
I know it just seems like when people come in and they get a procedure done, it's like, oh, just do the procedure and move on.
Mhm.
It's not like that. It really is like people are so dynamic, and it's like a diamond. People are like diamonds.
Mhm.
There's so many facets that can be different. No two diamonds are alike. And so you have to have a provider that really considers all of those facets. What's your lifestyle like? How's your stress level? Everything down emotional, spiritual, physical, all of it. So there's so many factors that go um, into a patient that need to be considered when planning treatment. and planning
Okay.
a treatment plan and then
Yeah.
articulating that treatment plan.
Yeah. No, very well said. Because I think
Yeah.
most people think about medicine, it's like, okay, follow this treatment, follow this procedure,
Right, right.
protocol,
Like it's,
or it's
yep.
like laser hair removal. Okay, just blast it with the laser, then you're good
Yeah, right.
to
So,
go.
so for you, I might use a laser setting. Like, let's say I was going to laser hair remove myself. I will use one laser setting, but on you, I might use a different laser setting based on the fact that you like to surf or whatever. I mean,
Mhm.
it might change things.
Mhm.
So,
Okay, good to know then. Now, Jameson, I'm sure that throughout your experience, you must have had some interesting cases or challenging cases that
yes.
have come into your practice. Is there maybe one story that stands out in your mind in particular of just memorable, challenging case, and really how you were able to get them a great outcome in the end?
Absolutely. So I had a patient come in and she wanted laser hair removal just of her underarms because that's typically where patients start. That's the toe dipper.
Mm-hmm.
And so she got laser hair removal of her underarms. I think she had clearance in like 3 treatments. It was real rapid. And she was like, oh my God, this is great. And I was like, okay, well, if you ever want to try any other areas, we can do that. And she goes, hey, do you know about hydronatus suppurativa? And I was like, no, I haven't really thought about that. And she goes, do you think you could do laser hair removal? And so I was like, let me look it up. And so this is kind of how I got onto this kick.
Mm-hmm.
Um, I looked it up. I was like, oh my God, this is actually a treatment for HS and it can be beneficial. And so this patient went from about 6 outbreaks a year of HS in her groin to less than one every 6 months. And she said she was so happy. Her husband was so happy because, I mean, even HS can, it's wounds. It looks like boils, and it can ruin a patient's intimacy with their partner. It can ruin their self-esteem, how they feel. It can make them self-conscious in a bathing suit. And I was able, just through laser hair removal, a simple procedure, to then reduce her HS outbreaks. And that's when I was like, oh my God, I got to start talking about this.
Mm-hmm.
And then I realized quickly that a lot of patients that I was even diagnosing with hidradenitis suppurativa didn't even know they had it. They just knew that their aunt or their uncle had it, or their grandma had it, or another family member had it, but they didn't think they had it. But they had those sores with scar tissue left behind. And it was just, you know, um, and being able to do that. Anyways, so that patient did really well. And yeah, she improved, and it fixed her.
Yeah,
It
that's
was
a great
great.
story. That's a great story, especially
It's
like now
true.
that now you kind of got onto that, and now it's like anyone that
Yep.
comes with that, it's
And
like, oh, you
then
know what to do.
and then to even go further, I started researching, well, how do we combat like inflammation? And so there's a number of inflammatory cytokines, which are inflammatory markers. They're interleukin like 6 and 8 and 17 alpha.
Mm-hmm.
And so then even for patients, I would go even a step further if we still wanted to try some more options besides just oral antibiotics. We would start doing radio frequency microneedling over those areas to promote healing. And so I started looking at studies where they had done fractional RF microneedling, radio frequency microneedling, to reduce the expression of those inflammatory cytokines, to reduce that inflammation and reduce those issues. And that's even proven good as well, because so then I can do laser hair removal and then RF microneedling and really help these patients that have just been battling this chronic condition, not even knowing what it was, thinking it was just like,
Mm-hmm.
oh, it's an ingrown hair, it's a boil, and it lasts for like 3 or 4 weeks. And yeah, so
That's incredible. That's an
yes,
incredible
sir.
story. Okay, now Jameson, where do you think the future of aesthetics is going?
Honestly, I can't even tell you that. I wish I could. That's the million
Mhm.
dollar question.
Yeah.
Um, I think we're going to see some really, really cool stuff come out. I mean, I think we're seeing more of a marriage between what people consider traditional medicine with um, with aesthetic medicine, or machines used in aesthetic medicine. So when I started this practice, I never dreamed that I would be using a laser hair removal machine to treat a condition.
Mm-hmm.
I just thought, okay, I'm just going to remove hair from people that don't want hair on their legs. And now we're seeing even machines that are treating dry eye, that were originally used for eyelid tightening.
Hmm.
And
Interesting.
so, I mean, the sky's the limit. I have no idea. I mean, I'm be fascinated to see what it looks like in 5 years from
Mhm.
now, where we're going to be with
Mhm.
things. I mean, I mean, I even treat bruxism, teeth grinding, with neuromodulators.
Hmm.
Um, I treat angular cheilitis when patients get sores on the corners of their mouth with lip filler. I mean, so I think you're going to see, I think you really will see things traditionally used as just cosmetic, just aesthetic, just for appearance, that are going to be used more towards, hey, what can we use this to combat a condition? Can we use this to help?
Mhm.
And I think that's cool. So
Okay. Yeah, I've heard of one thing that surprised me. I've heard that people can use Botox to help alleviate migraines.
yes,
I would have
absolutely.
never thought about that. I'm like, really? It's like,
Like when I got into it as well, I was using you can use Botox for heavy sweating, like
huh.
underneath the arms, hyperhidrosis. And it's really cool. I mean, I really think you're going to see more of that vein of
Mhm.
thinking. I even use my YAG laser, my ND YAG laser, to treat telangiectasias or spider veins, small spider veins that appear like on the corner of the nose or on the
Mhm.
legs. And so I think you're really going to see, as medical science progresses, um, you're going to see people using these therapies to assist in conditions that are just annoying. Like,
Mhm.
you know, hidradenitis suppurativa is annoying. Angular colitis is annoying. I mean, just spider veins. I mean, they're not deadly. They're just
Yeah.
annoying.
Yeah.
You know, it ruins self-esteem. And I think that patients, you're going to see a lot of that. And it's going to be cool. It's going to be interesting.
Okay. No, it's good. I think that sounds like it's a bright future. It's just a matter
Yes,
of when
sir.
science catches up to it.
Hmm.
Now, Jameson, for your practice, Nuvaderm Aesthetics, what's your vision for your practice?
Oh, my vision for my practice is what I look at the mirror and say to myself every morning. I want my patients to bring me the things that they don't want anyone else to see. I want you to bring me that thing that you're embarrassed about. I want you to show me the thing that you don't like, whether it's loose skin, it's a spider vein, it's a cheriomeningioma, if it's the fact that you sweat through your shirt when you're at a dinner party, if it's the fact that you've got sores on your groin, hidradenitis suppurativa, if it's any of those things, bring me the things that upset you as a patient, that you don't want your husband to see or your wife to see or your best friend to know about. And usually I can give you an option for that, or I can point you in the direction of someone that can. Patients should know, people should know, all people should know that you don't have to live with something. I mean, ask questions. It's a good thing to ask and research. And so the vision for my practice is that I want to be that driving force. I mean, for instance, I had a patient come in, and her, even if I'm not treating aesthetic wise, I had a patient come in and she couldn't see very well. And she said her eye doctor wasn't doing a very good job. And so I referred her to an eye doctor that I knew and trusted, and he got her fixed, and she was like, oh my god, it was like night and day. That's what I want to be. I want to treat the entirety of the patient, not just I have hair on my legs or I have a wrinkle on my forehead. I want to just help. I just want to help them.
I love
That's
that. I
yeah.
love that. Okay, well, for Jameson, I have one last question for you, but
Yes,
before
sir.
I ask it, I do want to point people to your website at nuvaderm.com. Now, I know it's the French spelling, so I guess I have to. It's NOUVEAUDERME.com,
Yes,
Nuvaderm.
sir. That's correct.
I guess if you want to go the French version, Derme. But
Nouveau Derme.
okay, well, Jameson, last question is, what does beauty mean to you?
I think beauty again is multifaceted. I think the beauty is definitely it's definitely deeper than just skin. I think that beauty is a culmination of spiritual, emotional, physical attributes that every person has, and that's really what I think it is. I know so many times we look at beauty as just being superficial or just being skin, but it's not. It's not. There's just so much more to it. I mean, uh, like I said, it's multifaceted. That's what I think beauty is. It's not just beauty's deeper than skin. So,
Okay. Well said, and there you have it. Jameson sharing his expertise. So,
yes,
Jameson,
sir.
where can people contact you in your practice?
You can go to my website, nuvaderm.com, or you can call us at 843-848-6322 and schedule an appointment. We are in Myrtle Beach, South Carolina, located in Market Common.
Awesome. Well, Jameson, this is awesome. Thank you so
Yes,
much for
sir.
coming on. Thank you so much for sharing your knowledge and your expertise.
Thank you, sir. I appreciate the opportunity.
Thanks for listening to the Beauty Talk podcast. any questions, please contact the practice directly with the contact information provided during the show. We'll see you again next time. Bye for now.